So in this video, I am going to tell you about classification of muscle and musculocutaneous flaps. This classification was given by Mathis and Nahai in 1981. So basically, they all the muscle flaps that can be used, like the latissimus dorsi muscle, gracilis muscle, gluteus maximus muscle, these can be all used as flaps. So they are divided, they are classified into 5 different groups, that is type 1, 2, 3, 4 and 5. So here type 1 are the muscles which have only one vascular pedicle. The whole muscle is supplied by one vascular pedicle. So if we want to use the muscle as a flap, we have to raise it on this pedicle only. In type 2, there is one dominant pedicle and minor pedicles. So even though there are dominant and minor pedicles, we cannot use the flap on the minor pedicles. So we can cut the minor and use the flap on the dominant pedicle, but we cannot cut the dominant one and use it on the minor pedicle. And in type 3, there are two dominant pedicles, so we can use either this pedicle or that pedicle. We can cut one of them. And type 4 is segmental pedicle. In segmental pedicles, it's quite difficult to use these as flaps, because if we cut these, only those segments will survive or something like that. And type 5, one dominant and secondary segmental pedicles. So this is something like 2. 5 is something like 2, but then the secondary segmental pedicles are not as minor as the minor pedicles. So the flap can be sustained on these secondary segmental pedicles. So you can cut this dominant pedicle and the flap can be raised on these secondary segmental pedicles, or these can be cut and the flap can be raised on that dominant pedicle. So how to remember the examples? So think of it like a thigh and leg muscle, a thigh and leg muscle, a thigh and leg muscle. So type 1, tensor fasciae lata and gastrocnemius. Tensor fasciae lata is on the outside of the thigh, as in the lateral aspect of the thigh. Gastrocnemius is on the outside of the leg, as in the posterior most aspect of the calf. Gracilis is on the inner side of the thigh. Soleus is inner to the gastrocnemius. So this is outer, outer, inner, inner. So you can remember it like that. And then two dominant pedicles. So two, where do we see two things? I mean, everything in the body, we have two, like two calves, two thighs, 2 feet, 2 hands, but then the most prominent features are 2 buttocks and 2 breasts. So 2 buttocks, gluteus maximus, 2 dominant pedicles, 2 buttocks, 2 gluteus maximus. And for serratus anterior, the breast is somewhere over the serratus anterior area, so serratus anterior. Segmental pedicles, you now think of segmental, so it is a thin muscle. So think of one thin muscle in the front of the thigh, that is sartorius, one thin muscle in the front of the leg, extensor hallucis longus. And for this one, I think for people who are in plastic surgery, it's quite easy to remember, because we all know that latissimus dorsi have such vascular pattern and pectoralis major have such vascular pattern. So no fancy way to remember this one. I think your actual knowledge will help you remember this one.